Mr. Jackson Ellers is a 17-year-old male high school student who was admitted to the ER this evening after falling off his skateboard on his way home from work and presents with severe pain in his right forearm in addition to minor cuts and scrapes on his elbows and knees. Mr. Ellers was in his usual state of excellent health until about 45 minutes ago when he fell off his skateboard and stuck out his arm to catch his fall and says he has, quote, sharp throbbing pain in his right forearm that began immediately after he fell off the skateboard. The patient is concerned he broke his arm because he plays high school sports and says the pain has been consistent since the fall. He raises pain as a 10 on a scale of 1 to 10 and says the pain is not radiated to any other areas of the body. He denies taking any medication to help alleviate his symptoms and says that nothing else has made the pain any better. He says moving his arm makes the pain worse, so he has tried to immobilize his arm as much as possible. The patient has no history of childhood illness and denies any current active medical conditions. The patient has never had surgery or been hospitalized and said this is his first time ever being in a hospital. The patient is not currently taking any medication, over-the-counter supplements, or herbal supplements. The patient is not allergic to any medication but is allergic to peanut oil. The patient claims he is, quote, pretty sure I'm up to date on all vaccinations, but says his mom, quote, takes care of all of that when asked about whether or not he has had his pertussis, tetanus, and flu vaccinations. The patient denies being sexually active, as well as denies ever consuming alcohol, tobacco, or recreational drugs. The patient also has never left the country. The patient denies family history of osteoporosis, cancer, cardiovascular disease, bleeding disorders, or substance abuse disorders. The patient denies hitting his head after the fall and denies ever losing consciousness. The patient is able to move his fingers without pain and says he did not notice any unusual bleeding after the fall. The patient did not experience any difficulty breathing or impairment of vision.